I am a woman. When will you marry? Whoa! Your eggs.
The eggs.
Your eggs are disappearing.
You don't know what happens when you turn 35.
These people are working as. These people are working as.
Who invited you?
I didn't invite her.
Who asked you to come?
I don't remember sending an invite. I don't. And now it's been framed to help us.
How about you get out of here?
Hey, anyways,
she said get right here. Get out of here, man. It's time for you to go. Yeah. Bye. Hello, Globies. Welcome to the World Health Investigation Podcast. My name is Jocelyn.
I'm Edna.
And I'm Loza.
We are three young global health professionals and your hosts for the World Health Investigation Podcast.
Also known as WHI, we'll be discussing all things global health and unpacking the most controversial health and social issues,
as well as promoting new wave global health development and equity.
So, ladies, before we get into the real global health tea, let's give them a little introduction about ourselves. We need a whole CV.
Yes.
So, Miss Edna,
tell
me. I know you've been doing stuff.
I've been doing the things.
One, two, come on.
Yeah. So I guess I'll begin with I'm from Zimbabwe originally.
Any Zimbabweans in the building?
Moved to Switzerland, when I was like 10, 11 years old. Been here for that long. Then went to uni in the UK where I studied applied medical sciences at UCL. Shout out to UCL. And then here I am now in this year. I am working.
A full working woman.
I'm
gassed.
I won't necessarily say the name of the organization, but it's with the HIV space. Yeah, that's where we work.
Big things.
Trying. But yeah, that's me.
Love to see it.
Next.
Oh, me.
Miss Joyce Lean.
Go ahead.
I'm originally from Cameroon. I grew up in Cameroon, born there, and then I had to move to Tanzania, and then eventually I found myself in Switzerland. And then I did my undergraduate studies in the UK, in London at UCL, in applied medical sciences as well. And I just started to dive into this global health field. We're gonna get into that later on, but not say too much.
You get.
And then I did my master's in infectious disease epidemiology.
Epidemiologist.
You get.
Shut up, please.
Our whole epidemiologist.
Now I'm working as a epidemiological analyst.
Hey.
And I look forward to starting this with you boys.
Putting all these titles.
And you know what I mean? She said.
And Lola, what about you?
Miss Loza.
Hi. Yes. So me, I'm originally from Ethiopia, and then somehow I landed in this Switzerland when I was 10. And then I did my undergrad studies at King's College London.
Ooh.
That's it. I was back up.
I'm supporting you.
I'm not. This
one's an 8er.
Never.
King's College London. Fantastic times, beautiful times. I did biomedical sciences. And then I did a couple. I wasn't sure where in science I wanted to end up. I did forensics once. I did little internship. But in the end, global health had my heart. So now I'm doing a master's at the University of Geneva in global health, and so that's what we're doing. That's where we're at. And that's
good.
it.
Okay, Miss Global Health, international based. Everyone here is international.
Yeah,
we have Zimbabwe, Ethiopia, and Cameroon.
Yeah,
we said worldwide.
We all somehow found each other in Switzerland.
I know, isn't it?
Geneva.
Then found ourselves in London. Lived together.
London
girls.
But Loza, you mentioned your love for global health. Can you tell us what drove you into this field? Why do you want to do global health?
It's sounds weird, but I love diseases. I like studying diseases because I think they're kind of rude. I want to contribute to providing better health for people, and then global health particularly because I saw so much inequalities and how people access health. And so to me, I saw global health as like the tool to provide, equitable healthcare for people. So that was
Equity.
why. Equity.
The key word is equity.
That's what I'm here for, you get.
Inspiring.
Okay.
Wow,
And you, Edna?
Gina.
Yeah. How did I get into global health? Well, I think it was just like it became a mixture of all my different interests. So similar to you, Loza, it's like I was interested in diseases, just the human body, how diseases work in the body. I was interested in that. And then at the same time, it's, coming from the background in Zim, where you see there's healthcare systems that don't really work very well. Yeah. But noticing that it wasn't just it's just a problem in Zimbabwe. It's like there's factors about like the world and the global space that is also contributing to the state of the health system in my own country. So then I also got a bit interested in like global affairs. I've always been interested in history, I always tell you guys. And then like the policy making side of it, like really trying to think like who is making decisions at the global level. So yeah, through uni, through doing different activities, listening to different talks, I just got more and more involved in like global health type stuff.
Yeah,
love it.
Okay,
love it. What about you?
For me, I think even before I did my degree in medical science, I thought about doing public health, but I just didn't know what it was about.
Right.
I didn't know. I was a bit scared. I was like, okay, I don't know what that field is. I don't want to go into a course that just makes me learn everything and nothing at the same time. So so I was a bit skeptical about it. But then once I got into my second year, and then I think it was Dr. Manny. Dr. Manny. Hey. Shout out to Dr. Manny.
Shout out to Dr. Manny.
He showed us this global citizenship program and the UCL global citizenship program, and I signed up for it. First year was okay. Did the second year, and it really caught my eye. It caught my attention. Like just looking at different people, understanding that someone in pharmacy could contribute towards health in a different country. And I also started to ask myself questions like, who decides, who can access what medication, who decides who can afford certain things like vaccines, who can afford tests, who can afford basic healthcare. And I just thought, the value of life is something that, a lot of human beings take for granted, but at the same time it's something that we have to strive towards, having an equitable world, equitable healthcare. But yeah, just keep it short.
And that's it.
I mean, I feel like we should still end it on a fun one still. Like Jocelyn, you asked earlier, like what gives you the global health ick?
Ooh.
The global health ick.
The global
health ick.
Hey, let me think of
this. Because I'm a healthy human being, right? Me as a person, I am healthy. You get?
Yes.
Some people do not like someone else. Let's say I think healthcare sometimes can be ableist. So someone that is born with a certain disability of any kind would not necessarily be able to have access to some of the healthcare services that any regular healthy person would have.
Right.
Yeah. And I think that the fact that people sort of overlook other people's health or prioritize certain lives, like rich lives, over poor lives is ridiculous.
Ridiculous.
Unacceptable.
Unacceptable.
Can't have it.
Yeah.
Just because I'm rich doesn't mean I deserve to live. Just because I'm poor doesn't mean I don't deserve to live.
Amen.
So that gives me the
ick.
The ick.
Now, yeah, following from that, my ick, I just, you inspire me. For me, it's the profit-driven health. Like, profit-driven healthcare. Right? When, like, I don't want to add places, but
we are not down. We're not sugarcoating anything. Remember,
anybody can get it.
Anybody can get it,
unless it's a future employer.
Yeah,
please do not.
We are passionate.
We're passionate young people.
And we want
care. Please don't cancel us.
But I'm just gonna say. Big pharma.
They can't hear you, girl. They can't hear you. Say it louder for the people in the back.
Yeah. For me, what the big ick is when you're producing medication and you don't make it accessible to everybody. And it's like, we know like the right to health is a human right, and you say this and everyone's like, I agree, I believe it, but then you will hike up the price of medication beyond what it's meant to be, knowing people will die without access to that drug. Is disgusting. It's disgusting. It's disgusting, and it's embarrassing. So for me, that is my ick.
Somebody making noise in the back.
Just broke something.
Yeah.
Maybe it's Big Pharma. I don't know. Maybe they're coming for me. I'm sorry. I'm just kidding.
No, we love you guys.
No, it's just kidding. Like, thank you for innovation. Love research and development.
Exactly. No, I'm not gonna defend Big Pharma. Let's not get into that.
Okay, speaking of you not defending Big Pharma,
what are you?
What's your ick?
My ick is just like hands down the colonization. It's the colonization.
The colonizers.
The colonizers.
They're like, strong in global health.
To think there was a time I didn't know like global health could be colonized, because you think health, human body, science. We have science.
Yeah, it's science, right?
We have data.
It's based on evidence. That's
this person has disease X. We have drug treatment. It only makes sense. No. The colonizer said no. Not everyone deserves that.
Yeah.
It is the fact that you take a black person who goes to a hospital, they won't get treated the same way as like a white person who goes to a hospital.
We're all equal. Some of us are more equal than others.
Yeah. Well. Animal Farm. Read it.
Educated baby.
Yeah, so that's what gives me the ick. It just does not make sense to me. The prejudices, the discrimination, the systematic racism of it all. It's just not giving.
It does not add up. In healthcare too,
In healthcare.
You're fighting for your life.
Do no harm. Do you forget that your Hippocratic oath? Anyways, exactly. But the one thing though, the words that come to my mind when I think of this colonization that you're referring to, Edna, tropical medicine. Tropical medicine. Tropics. Initially, that term was used to protect the colonizers from the diseases of the tropics.
Who invited them to the tropics?
Who invited you?
I didn't invite them.
Who asked you to come?
I don't remember sending an invite. I don't. And now it's been framed to help us.
We are the problem
Africans.
And now we're always getting help. We want to be able to have our own, not to be receiving help all the time.
Yeah, well,
we had our own until they decided to just.
Well, how about you get out of here?
Hey, anyways,
she said get out of here, man.
Get out of here, man. It's time. It's time for you to go. Yeah. Bye.
But moving on.
What we're here for? We have
today's episode actually.
To discuss.
This is episode 1.
We are women.
We are women.
We're women.
I am a woman.
When will you marry?
Whoa! Your eggs.
The eggs.
Your eggs are disappearing.
You all know what happens when you turn 35.
You're almost 35, girl. You're almost 35.
No, what do you mean?
Listen, 22 to 35, 2 seconds.
2 seconds. Next thing you know is you're a grandma.
I'm just saying.
What is all this fear mongering? I don't understand.
I just say freeze them eggs for like a small time.
How do we feel about freezing our eggs? What's the big problem with this fertility concept, fertility industry?
Well, that's what our episode is about today.
Let's get into it.
The fertility industry. I mean, listen. I'm not here to be bashing it, because I think it is amazing. Many women are able to have children now because of, these innovations like IVF, even freezing your eggs, it can give you more options as a woman. Mm-hmm. Lovely. But it's a little misleading. It's a little misleading.
A little bit. Yeah.
And we're going to unpack that. Mm-hmm. We're going to unpack that today. So, we've given the scenario as women, we do hear it a lot. Your biological clock is ticking. You turn a certain age, you're a high-risk pregnancy. All of that stuff. And, that can be taken by certain places to take advantage of your fear. And be like, okay, here are some solutions. But are they really solutions? So I don't know. What do you think? Would you guys freeze your eggs?
would I freeze my eggs? Oh, that's you know, I always hear about these things, yeah, but I've never actually thought about it.
Yeah, facts.
Oh, listen, if I reach the age of 45 and, you know, there's...
No,
45 is too late.
No, but
there's still no hope.
Eggs are fried.
I want to have children, but I don't know if I'll freeze my eggs.
Fair enough. I mean, let's look at, you know, the information. And then let's see what we decide at the end.
What about you guys? Would you freeze your eggs?
Would I freeze my eggs at the moment? You know, I've considered it a while back, because I said I want to do so much with my life, but at some point I want a kid. And when I was younger, especially, it seemed like an easy peasy lemon squeezy solution. Get a couple eggs, put them in there. When they're ready, they'll come out. And I said, okay. Now, you know, for reasons I'll get into, I'm not sure. I'm not so sure anymore.
Let's get the truth right now. Would you freeze your eggs?
Would you freeze your eggs?
Would I freeze my eggs? Not before you actually told me about this whole thing, you know, before the research about all of this stuff. I really had not thought about it. I thought, like, why would I go about freezing my eggs? Like, that's not a consideration for me.
That's none of my business.
If I'm like, none of my business, I'm like, yeah, I guess I just assumed it wasn't something I would factor into my own plans. I was like, the plan should be fine. Things should work out. You know, it should be fine, but I can see why others would do it. I don't know if I would do it still, but I understand the idea of, yeah, you may have your plan of like, okay, by this age I'll, like, you know, you would do the whole thing without doing egg freezing. You can, you know, get your baby or whatever. But it's nice to have like a backup.
A backup.
It's nice to have a backup.
And it takes us to I guess the case study I have for this. Where there was a woman in Singapore, and she had been planning to have a kid with their boyfriend. He passed away. And so then she was in
That's so sad.
It's tragic.
It's tragic.
But then so she was in a position where she's not gonna immediately now be like, let me find another man.
I mean, some of us would.
Hey. Actually, some of us are ethical people.
You know, we're ethical.
So, but so she was thinking, okay, what do? I still want to have children, but you know, not right now. It's a bit peak. So she thought about freezing her eggs. Now, issue. In Singapore and a lot of Asian countries, it's illegal to freeze your eggs unless you're doing it for a medical reason. So she had to travel to a different country to be able to have the procedure done. You know, it was very expensive, but she had the capacity to do all of that. Now, not many women have that option, and from her perspective, you know, it's important that women have this reproductive choice to be able to have a backup plan. So that's one thing, the way you said it, like a backup. It's useful for that, but then she also looks at the downsides, which is that it's very expensive. The average woman is not able to do it, and actually in the end she did have a successful pregnancy, but it wasn't from the frozen eggs. She actually still had eggs that she could use for IVF.
Yeah, so I mean, I think you bring up a good point about, like, or at least that story brings up a good option. That story brings up a good point about how this whole egg freezing thing can give women like options. Like, obviously, there's a tragic like situation where she, you know, to buy some time, and you know, things didn't go to plan. So that just also had me wondering, like, you know, what other reasons people may have besides just like choosing to do it. Surely there must be like other reasons to choose to freeze your eggs.
It's not always a choice. Like, for me personally, if I was to get an estimate of how likely I am to have a child at the age of 35, and I was told I wouldn't be able to, then I would consider freezing my eggs. So it could be for medical reasons. If any one woman would say that she has cancer, endometriosis, any reproductive related health condition, it's a valid consideration. Beyond just choosing, I want to prolong my career, or I want to please my family.
True.
And I'm sure also some women just don't want to get married, and they don't want to. They don't want they want to have that option, but they also want to stay single and just have a child.
Yeah.
I know, and I think it's all valid, but definitely, like, originally the reason egg freezing was approved and practiced was for medical reasons. So it was for women that had cancer and that were, going to go through chemotherapy that might, destroy their eggs. So this was kind of giving them an option to be able to have a child later on. But I guess that's where the misleading part comes into it. Right? So essentially, as I said, the reason why it was approved was for medical reasons. But because of a lot of the fears about biological clocks and all of that, it really started getting marketed at young career women. Like, okay, here you go, like, here's your backup plan if you don't want to have kids right now. And, there were companies, it was really controversial. I don't know if you guys remember in 2014, companies like Apple and Facebook were giving women these packages, like, you can freeze your eggs too, like, we'll pay for it, don't worry. Which kind of sends a message, like, y'all can't have kids on this job right now. Y'all better not get pregnant right now, y'all better wait. Anyways, there was an outcry, but it was kind of, that was the attitude, There was a doctor that said, this will be the new 30th birthday for every woman. Revolutionary. But the reality is, to this day, that procedure is actually recommended only for women that need it for medical reasons, because a lot of those eggs are not viable, right? So the percentages vary depending on the study and depending on the age the woman gets her eggs frozen. But once they're frozen and thawing them out and actually getting pregnant from them, it's very slim. And I think that is not advertised properly.
It's not, and
that's where.
And I'm just thinking, it's interesting how you mentioned how these Apple big companies, these big names, they like giving you something that looks like it's good for you, but it may not actually be to your best advantage. And I think it's also interesting how it's a lot of the times it's the men that make decisions about what women want or decide to choose. And the fact that even with this case study with this woman, how she would have to have a medical condition in order to choose.
Absolutely.
Like, who is making these policy decisions?
Right.
Who is deciding that, okay, you know what, I am your father and I'm going to tell you that you don't need to freeze your eggs, it's bad for you. Is that what policy is? Do people actually have the freedom of choice?
Well, that's a very good perspective, and it's true. No, it's true, because like, she was willing to pay for it. She could afford it. And it's really crazy that a government will have the say over your reproductive rights. It's a bit wild to this day. And so it's like, it's two things, because from one side they are preying on women, in a way kind of misleading and talking about, this is a great option, but then for women who actually want that option, they also don't have access to it. So
don't.
It's like,
but I think it's also important, like you pointed out, that when the big corporations came in, and they also have the incentive, of course, to keep women in the workworkforce and be like, don't worry about the kids, capitalism, just stay in your job, you will have your plans and whatever. So when you're mentioning that, and you talked about, like, sometimes I feel as though I don't think women are always, like, well informed about, like, how all of this actually works, like the process of, like, what does it mean for you to, like, freeze your eggs? It means we're gonna take your eggs, you're gonna I don't know the full process. I don't know if you guys are, like,
you have to get hormones injected, you have to do it yourself.
Exactly.
Can be several rounds, because you might not get the eggs the first time. Really expensive. And one big thing about it, actually, from what I noticed, is the younger you are when you freeze the eggs, the more viable they are. So if you're like 25, and that's the results they advertise usually. Problem is, now which 23-year-old has $20,000?
That leads me to my next question. When we're talking about this fertility concept, right, is the act of freezing your eggs, or wanting to freeze your eggs, or having that, let's say, in a healthcare system, is that equitable? Would you consider that equitable? If it's very expensive, and only a certain group of people can access it, of privileged women, would we consider that equitable? I don't know. I don't think so.
No, and that's what I also found interesting in like the video where we told the story of the woman, and we'll link to it.
You go
in the bio.
It's a good video, Refinery 29. Yeah. So how they brought up the point of like maybe governments should be subsidizing egg freezing, right? And I thought that was interesting as well, because for many women who are able to for like medical reasons, for cancer treatment, endometriosis, they can get like, you know, the insurance company to cover like the treatment and stuff like that. But for women who are just electing to do it, so like let's say if we just decided like I just need to freeze my eggs for whatever reason, career wise, would it should the government cover that for you, basically, at least partially? Personally, I don't know. Personally, I don't know.
Part of me, for the sake of equity, I would say yes. But then from the because the thing with policy is you really have to get the political will. You have to convince the government this will help you. And the difficult thing with egg freezing at the end of the day is the viability of it. Is that government investing in something that will, because I know there's a lot of like France and stuff, you know, their population is decreasing, so they, you know, have incentives for people to have children, so this might be a good, you know, incentive to subsidize it. But how viable? Like, it's not viable.
The like viability, and it's also, I think with policy is equity doesn't just mean that we need to have everything. Everyone needs to have everything. It means what is the best way for us to use our resources and produce the best result. The best result could be on a profit level, not good, or it could be on, let's say, the quality of life. It could be on the number of lives saved, or it could be the number of lives that have been improved as a result of that. So in this case, as Loza said, because it's not necessarily viable and there's a very low success rate,
it's hard because, at least for me, for example, I'm also a believer in, like, you know, you want evidence-backed policies as much as possible. And what we see here is that, like, it's very difficult to, like, you know, make a case for, like, you know, egg freezing because of the issue with the success rates. It's not always easy to back that. So no, it's not easy to, like, back policies with the low success rates we see here. Which leads me to something I was reading around also the lack of understanding we have on like how fertility works for women, and just like why we have this like research gap at the end of the day in terms of like women's reproductive health and like fertility and all these different things. So to me, it's like, instead of maybe focusing on like, okay, should we subsidize you know, egg freezing, should we focus more on like research into understanding women's fertility?
Absolutely. No,
because they haven't researched it. How are we gonna know if it's not being researched?
Exactly.
That's the big thing. Yeah, like, I don't think we're there yet to be subsidizing, because let's make the product better. You know, because you see success rates being published, you know, with systematic reviews that have been done. You'll see somewhere it's 2% that it's viable, 90% somewhere else, 6%. It's not even consistent at the moment. And so, I mean, in general, in women's health, so much research needs to be done.
And the problem is that a lot of these success cases that we see are very individualistic.
Absolutely.
It's like you see one influencer, one celebrity that she did it and she succeeded, but she has a whole different lifestyle, and we don't have, I think the numbers are quite biased and skewed. Like, they're only sharing information about younger women.
A lot of the times that's the case.
We rarely ever hear about older women that have successfully done this procedure and had their baby.
It can be traumatic as well, like going through, and I've heard like case studies with egg freezing and with IVF as well, going through the rounds of it, and you know, the money that it takes, the hormones that are you know, that you have to take. In the end, when it's not successful, it can be traumatic. And I think that's why managing expectations is so important, and I think it is the responsibility of the providers to actually communicate it properly, and I don't think it's being done enough.
And before if you ever think of freezing your eggs, before you decide to embark on that journey, please do your research.
Like,
ask a medical professional, publish papers, not just your own research, but speak around, ask people, ask different people, speak to a medical professional, because it would be it's a very traumatic experience. Like, imagine having to inject needles into your body,
and it's just relying on it as a foolproof thing, manage, like, it's a great backup, but really be realistic about it. It is no foolproof at all.
No, definitely. I was reading out as well as like many doctors are like, like you were saying, it's targeted towards people, towards the younger side, like younger women, young professionals and stuff like that. So sometimes you're hearing doctors where like people our age will come and they're like, I need to freeze my eggs, and the doctor will be a bit like shocked, because it's like, you're young, you're 23, you don't seem like you have any like pre-existing conditions, like you don't have to be in such a rush to do this, because it's also like a huge financial investment on your part. And to almost like you need to rent
like upwards of 20k.
Upwards of
20k.
So it's not like a light decision to just make. And like you're saying, Jocelyn, just like you need to speak to your healthcare provider if you have some pre-existing condition. I know I was reading that I think if there's history in your family of like women starting menopause early, then at an early age you can start thinking about, should I be freezing my eggs? But
and another thing is, should women really be spending that much money to give life that usually happens naturally?
It's rough.
It's a very intense question. It's a very intense thing to think about. But it's almost like unless you don't have a choice and you have a certain condition and you absolutely have to do it, it's still not okay. But even if you decided, okay, you know what, I want to have children but I can't, or I can or I can't, should you pay that much to do something that you know is possible naturally?
But that's the thing, like, do we always know that it's possible? Like right now, I'll be honest, like I've never had like my fertility checked or anything like that. And as far as I've heard as well, like there's multiple ways to check fertility. It's not just like one test. So I think the common one is like you test your blood and they see the hormones in there. But like, you can also like monitor your body temperature, all these different things. So many things. There's so many things, and it's like not an exact science, I don't think, as far as we know. So yes, it is something that can happen naturally, but it's not like, again, as not everyone can do it naturally. I don't think so.
And I mean, and that's why I do think like it has its good points. Like it is really useful. Now, do I think, it's rough, because it's true, especially like in cases of IVF and everything, where women can't have children and having to pay all that money.
It's like I think this woman mentioned paying around $30 in total. 30,000. $30. I wish. $30,000 for a procedure that's not guaranteed.
That's where my issue is with it. And I mean, when you say that, also I think another dimension to look at it is from why do women feel the need to delay pregnancy so much?
That's a good question.
And I guess I hinted on it with like Apple and Facebook, and their thing is it's really difficult to balance in the current economy.
And now I have another question. Now, do you now think that since Apple and all these big companies decided to help us women,
appreciate it,
do you think that companies should start doing that, offering that as an option?
No, I mean,
yes.
We disagree.
We are disagreeing. You know why I say no? I think it's really the message that it sends. I think companies should be making it easier for women, for mothers, to continue to actually work. That's not the root of the problem, isn't it? Like I don't think it's actually fertility. Like I think companies shouldn't be so hostile to mothers. That's where I'm at.
I hear that. But I'll say the reality is these people are working us. These people are working us. They should at least offer something for all my labor and all my struggle.
Okay, you know what?
Like, give me some benefits at least. I'm sorry, like
the fruit of my labor is my baby, my babies.
Exactly.
You know?
At least if they can promise that they can cover some procedures for me, I'll be like, oh, okay, I'll work the extra hour, you know?
No, I hear you. I hear that. I think it is the way it's presented.
Yeah.
That's really big. And I think that's why I don't think they still do it anymore because it was controversial. Like, people didn't take it well. Yeah. I think it's the way they said, here's a gift card for, to freeze your eyes. I think more so like, we'll cover it if that's what you want to do. Yeah. It might be a better approach.
Yeah. But then again, it kind of... the problem with it sounds nice on paper, but it just gives this impression that women are a burden to the economy.
And which part?
In terms of, okay, I'll need you to work for as many hours as possible. Your reproductive health,
it's inhibiting that.
It's not profitable.
Yeah.
It's not giving.
It's not giving. It's like, if
that's the
that's the problem with it. These companies need to start embracing, acknowledging, and accepting the fact that women are capable of giving life. Whether or not it is profitable to your company, women are capable of giving life and working at the same time. And it is not your decision to make of whether or not they choose to work with you, regardless of their fertility outcome.
Preach.
She said what she said.
Yeah. I was joking, by the way, about them actually offering like it actually would not make sense.
But you've convinced me a little bit that they should cover it.
They should cover medical expenses to some extent, all of them. But I want to say have a policy specifically hello, women of the workplace. By the way, just for you, we've got you.
Wait till you're 50, yeah.
That'd be very odd.
Yeah, I think now it's good with the parental leave and the paternal leave and maternal leave. That's a good step.
I think some countries do it better than others, but I think we should all go in that direction instead of pressuring women to freeze their eggs and have a 1% chance of having a kid.
Yeah, I think it's more of a matter of the companies, organizations adapt to the woman rather than you women adapt so that you can still work for us. There are places I think that offer daycare or something at the office or whatever.
I'm thinking
so it's we as a company are adapting to your needs.
So, that's amazing. That's beautiful.
Because it reminds me of a conversation we had where we're working, right? But it is designed. It was not designed for us. And we're trying to fit so the working world was not designed for women.
No.
And we're trying to kind of fit into a box that was already designed for men. And it is a lot.
And then you end up having to either make a sacrifice for your career or you just you sacrifice one thing or the other.
Yeah. You can't have both.
And
apparently.
Apparently you can't.
Honestly,
unless you're a boss babe.
Unless you're no, but I am a human being, an individual trying to make it in life.
I think that's the thing. It's it's a rigid structure and we're trying to change something that's already really rigid.
So on that note, ladies, what piece of advice you have to give our fellow Globies about this fertility idea? Our female Globies.
So that's for the women.
Fellow women.
Advice,
Men can have infertility issues too. They can freeze their sperm. That's also an option. But it's okay. Sorry, I just had to leave that one in there.
And it's so easy.
Consider it.
It's so
easy.
I mean,
you're on the magazine and it's done.
You know what? That one we'll cover.
Then they say, we have so much sperm.
Anyways,
we have sperm at the age of 70.
No, this one we must cover at some point. Contraception and everything for men versus women.
We're coming for you. Don't worry.
To be continued. But absolutely.
Now I think what I would say is, from an employer's perspective, if you own a company or you're a shareholder or you are part of the human resource team or in fact if you're doing any corporate law, right, we need to really push for that support for women, that support system to enable them to have kids and not have to be put in this very difficult position of having to choose between their career and their family life.
No,
and
I agree.
And I think also ensuring that women are adequately and properly educated around the topic of fertility.
That's what I was
please the fertility industry, if you find yourself there, if you're listening
you
to this,
end up here,
and you tell the truth.
If you have power. you know, what is it? Academic integrity?
Academic integrity.
Is like,
honesty.
You know, like, actually advertise the real results for all age groups. That's all I say. But for the women, I mean, I think we've said it. Research. We're in this together.
What about you, Anna? Do you have is there anything that you think really needs to be done out there?
Yeah, I think it's back to the point of like looking into this research gap that we have around even just fertility specifically, but just women's health in general. I think that's gonna help a lot in terms of like how we allocate actual financial resources that can help with everything that we're talking about here, like when it comes to the workplace, so that workplaces don't have to pressure women into like, you know, freezing their eggs or whatever. And then also I guess it would also minimize the pressure on women as well to feel like they have to go out of their way to research these things, to be googling and doing all this in like research. But the thing is, the research isn't there in the first place. It's just not sufficient. So it's hard for people to find it. So to me, I think it's that research gap that I think needs funding.
Yeah,
amazing. I think we could close it here. I think that we've covered a lot today.
Covered a lot,
and I think we definitely have. There's a huge gap, and there's a lot of work to do, but it's possible. And we women need to stay fearless, you know, do what you need to do. It's your choice at the end of the day. Just stay informed. So on that note, we're going to conclude. Thank you very much for listening to this podcast. Thank you very much for joining the World Health Investigation podcast episode 1.
Y'all.
We are closing the episode, and we hope to see you next week. Have a lovely week.
Yay!